You are listening to Repetitions with Daisy and Jack. Today we are giving you real, science-backed research with zero ads for supplements. On today's episode, we're breaking down why mewing won't actually reshape your skull as an adult, and what science says really influences the structure of your face. Mewing. I want to know how many hours of tongue placement went into the forums this week alone.
Billions of TikTok views and counting. And the central claim that pressing your tongue against the roof of your mouth reshapes adult facial bone has no peer-reviewed trial behind it. Not one.
Which is a problem, because I actually did this. 8 months, genuine effort. Tongue up, whole surface, the full protocol.
And
My jaw looked exactly the same. What changed was I became unnervingly aware of my tongue at all times, which is a strange gift no one asked for.
that tracks. So let's talk about what the community actually believes. Because the claim isn't vague, it's specific. Tongue pressure on the palate, sustained over months or years, mechanically expands the maxilla, reshapes the upper jaw, produces visible bone-level changes in adults.
And the appeal is obvious. It's free. It's invisible. You can do it in a meeting. It promises the outcome of jaw surgery through tongue placement. That's a compelling pitch.
It is. And here's the part that makes this genuinely complicated. The underlying premise isn't invented from nothing. Tongue posture does influence craniofacial development. That's documented across multiple studies in the orthodontic literature. Mouth breathing, low tongue posture, narrower palatal arch, these associations are real in children and adolescents.
So the seed is legitimate.
The seed is legitimate. The extrapolation to adults is where it falls apart completely. The key structure here is the mid-palatal suture, a fibrous joint running down the center of the roof of the mouth. In growing patients, that suture is patent. It can respond to sustained pressure. It's why palate expanders work in kids.
Clinical appliances, not tongue posture.
Right, and that distinction matters. Profit and Fields, the canonical graduate-level orthodontics textbook used in essentially every accredited dental program, draws this line explicitly. The mid-palatal suture starts ossifying as early as 15 or 16. In most people, it's fully fused by the early to mid-20s. Once it's gone, it's gone. There's no suture to open.
So if you're 23 and you're mewing, the architecture you're trying to change doesn't have the biology to change.
Correct. And the force differential makes it even clearer. Clinical palatal expanders in growing patients deliver sustained orthopedic forces, multiple newtons, calibrated, delivered across a patent suture over months. Resting tongue pressure is measured in grams, intermittent, against fused bone with no growth center. Those are not comparable inputs.
The forum response to this is always Wolff's Law. Bones remodel under mechanical stress, which is real. I know it's real from training. Load bone, it adapts.
Wolff's Law is real. Applying it to justify mewing is like citing Newton's laws to justify perpetual motion. The principle is sound. The application is fantasy. Cortical bone responds to cyclic, high-magnitude strains, weight-bearing exercise, impact loading. Resting tongue pressure against fused palate bone does not produce the strain pattern or magnitude that drives meaningful remodeling. And the force vector is wrong. Maxillary expansion requires lateral and anterior force across a patent suture. There is no suture. There is no path.
The American Association of Orthodontists said as much directly.
They did, in a position statement that addressed mewing by name. The AAO acknowledged that tongue posture plays a role in normal development during growth, then stated clearly, there is no scientific evidence that mewing produces measurable skeletal changes in adults. That's not a fringe view. That's the field's consensus.
And then there's Mike Mew himself.
Who was struck off the UK General Dental Council register after a fitness to practice hearing found his claims about orthotropics were not supported by evidence. I'll say this carefully. Deregistration doesn't disprove a theory. Arguments from authority cut both ways. But it is factually relevant that the primary clinical proponent of adult mewing failed a professional regulatory review specifically over these claims.
The forums treat that as proof of suppression, mainstream orthodontics protecting its business model.
Yes, the $12 billion supplement industry is very concerned about tongue posture cutting into margins.
Fair. So where does the evidence actually hold up? Because there's something real buried in here.
There is. Camacho and colleagues published a systematic review examining oropharyngeal exercises in adults with obstructive sleep apnea. They found roughly a 50% reduction in OSA severity. That's a clinically significant finding.
But the mechanism isn't bone.
Not even close. The mechanism is soft tissue and neuromuscular. Stronger tongue musculature, more toned soft palate, less collapsible airway during sleep. That's real. That improves airway function, reduces snoring risk, improves sleep quality. What it does not do is expand the maxilla or sharpen the jawline. The mewing community has taken a documented phenomenon in children and a legitimate airway application in adults and cargo culted them into a facial restructuring protocol.
Which brings me to the before and afters, because that's the core evidence people point to, the transformation photos.
Uncontrolled, unblinded, confounded by lighting, camera angle, facial hair, weight change, jaw clenching for the photo, and years of general maturation. A person who starts mewing at 19 and posts a comparison at 24 has also aged 5 years, potentially changed their body composition significantly, and learned which lighting makes their jaw look sharper. That's not evidence of bone remodeling. That's Instagram.
I'll tell you what actually changed my face between 19 and 24. I dropped from around 18% body fat to closer to 12. Jawline appeared. Cheekbones got more visible. Nothing structural. The fat distribution shifted, and the underlying structure became readable.
Which is the highest return lever available to most people in this demographic. Facial fat, buccal fat pads, submental fat under the chin, responds to systemic fat loss. That change is real, it's evidence-based, and it doesn't require 8 months of tongue awareness.
What else actually moves the needle?
Nasal breathing dysfunction is worth treating. But treating means addressing the actual cause. Allergic rhinitis responds to nasal corticosteroids, which are first line per clinical guidelines. A deviated septum or turbinate hypertrophy needs an ENT, not tongue posture. Cervical and thoracic posture genuinely influences how the jaw and neck look. Forward head posture creates submental heaviness, and that's addressable with targeted exercise. Sleep quality has measurable effects on periorbital edema and skin tone. These are real levers. And if someone has diagnosed sleep-disordered breathing, legitimate myofunctional therapy conducted by a qualified clinician is evidence-backed. But that's structured treatment for a clinical problem, not a facial aesthetics protocol.
The hard truth for someone who's been mewing for 2 years. The tongue placement didn't do what you hoped. And that's not because your technique was wrong. It's because the mechanism doesn't exist in adult bone.
The sutural fusion timing does have individual variation. The literature doesn't draw one precise cutoff. Some people may retain partial sutural mobility into their early 20s. But the honest statement for most listeners past their mid-20s is that the window is closed. And for anyone approaching it, passive tongue posture is not delivering orthopedic force at a level that would matter, even if it were.
And the opportunity cost is real. Every month spent waiting for mewing to work is a month not spent on the things that actually do.
The evidence verdict. No peer-reviewed controlled trial supports adult maxillary expansion through tongue posture. The field's consensus textbook, the professional association, and the regulatory body that reviewed the primary proponent's claims all land in the same place. The legitimate version of this, Oropharyngeal muscle training for airway function is real, but it's a different claim entirely.
So here's the actual protocol. Lose the face fat if body composition has room to move. Fix the breathing if breathing is actually broken. And get your sleep right. That's the stack. The tongue can rest wherever it wants.
And that's our show. Thanks for joining us on Repetitions. If you liked the podcast, you can show our team some love with 5 stars and a follow. See you next time.
Grab news. Thomas.